What's up, friends? It's been a while. I've been meaning to make this video and just haven't really had time or energy or a desire to be in front of the camera lately. But here we are today giving an update. I am trying to hide my messy bedroom because it's a mess. Okay, it's a mess. But whatever. We'll start with this. We'll start with today. Today's November 7th. It's a Friday. And something that cancer has taught me is that you can make all of the plans that you want to make. But if you have to pivot because life just has a way of throwing curveballs. What do I mean? I had it all planned out. I was going to take my daughter to her appointment today and then go shopping for the baby because she needs new clothes, and then go get an oil change, and then go get my car washed. It was all planned. And then the little one decides, I'm going to have a meltdown. I'm going to have a meltdown today. I'm going to have a meltdown. And I'm talking, it was just screaming and just the terrible twos. She's not 2 yet, but the terrible twos are here. And I'm just like, you know what, pivot. We're not doing any of those things. We're going straight home. We are putting this child, this child of God, in her bed so she can nap. And then when she wakes up, hopefully we can go back to our regularly scheduled programming of shopping and running errands. But I've said all that to say that I have been taking life one day at a time, just trying to focus on healing mentally, emotionally, physically, all the things. So let me just share what are some things that I've been experiencing on the physical side. So on the physical side, I have started Lupron shots and Anastrozole. So I get the Lupron shot once a month, every month. So I've had 2 shots thus far. And Anastrozole is a pill that I take every single day. I think for the next 5 years, quite possibly 10. My doctor won't know if I'm on the 10-year plan, probably for another, year. She's going to kind of see how I'm doing. And I guess she'll make a decision then if I'll continue that treatment for the 10-year plan. But right now, definitely 5. The Lupron shots, I don't know how often I'm supposed to get these or how long my treatment is for Lupron. I think I've decided I'm going to do the 3-month shot. So I get the shot in my butt. Yes, in my butt, okay? I get the shot in my butt, and then right now I'm on the 1-month supply, so it lasts for the whole month. And then if I'm approved for the 3 months, that means I don't have to go into the cancer center every month, which that has been playing a role in my mental health. Just having to go to the cancer center every month and feel like I'm reliving cancer all over again. So I'd appreciate the 3-month shot so I can have a little bit of a break. So we'll decide that at the end of the month. So what are those things for? They are to medically castrate me. It sounds so OMG, but that's how they write it on the papers. In essence, it's just hormone blockers. They are blocking my hormones. The cancer that I had, Curtis, Clementine, and all them others, were highly fed by progesterone and estrogen. So they were hormone positive cancers. And so I am on hormone blockers. So I have been put into menopause. I mean, I was already experiencing menopause because of chemo, but I'm now officially been thrust into the world of menopause. I do have hot flashes. They're not so bad. And I kind of enjoy them because since I live in the Northeast and it's starting to get cooler, it just feels good. You get a hot flash and you open the window and you get this cool blast of air. It's so I'm okay with that. I don't have night sweats, not as much as before, but that's where we're at. I am having some side effects from the Lupron and the Anastrozole, and it's body aches, bone pain, I definitely feel it if I'm sitting for a long period of time. I feel achy. And then, I don't know which one causes it. Hi, buddy, what you need? Okay, so I don't know which one is causing it, but for sure, whatever it is that I'm on causes body aches. So in addition to the anastrozole, I do take Claritin, and this is something I had been doing since chemo. The first chemo that I was on, I had to take like a bone marrow medicine to ramp up my white blood cells, and that would cause bone pain. So I would take Claritin. And so I've been doing that. So I take Claritin every day, and I do those 2 drugs. I also do a multivitamin. I'm doing the biotin for the hair, and I do take magnesium glycosate to help me like relax a little bit. So physically, that's where I've been. I've been experiencing some constipation, and I just think it's because of the way that I'm eating. I'm not drinking enough water. My eating has tanked because I'm dealing with a little bit of depression right now. And when I'm depressed and anxious, I tend to binge eat, and I tend to binge eat all of the wrong things. So we're trying our best right now. To finish off, I guess, talking about medications, I am gearing up to start a 3rd medication, which is my targeted therapy, and that's Kisqali. So it's a drug that apparently targets like direct cancer cells, and I am at risk for recurrence, which is something else I want to talk about. There's so much on my mind right now. I don't want this to be a super long video, but it probably will be. So I guess looking back at this past year, there's certain aspects of this cancer journey that I did not realize were what they were at the time until now, as I'm reflecting and I'm looking at it all in hindsight, and I'm realizing that there were certain aspects of my case that were quite serious. I kind of just kept thinking stage 1, it's no big deal. Stage 1, it's no big deal. But, you know, the stage 1 then became a stage 2, and then it just evolved from there. And then I didn't realize, but the type of metastases that I had, granted, didn't spread too far, but was pretty significant, because the tumor that was found in the lymph node was actually larger than the actual tumor in the breast. So the cells were growing and multiplying rather quickly. So all of those things have played into the fact that I am at high risk for having cancer again. So we opted for a more aggressive treatment right now, because the less aggressive treatment would have just been take tamoxifen, which is a hormone blocker, for 5 years, call it a day. But I chose the more aggressive path. I chose, you heard me? I chose the Lupron shots, the AI inhibitor, the Anastrozole, and now the Kisqali. So I'm doing 3 of them because I want to be alive for a long time. And so that's what we're doing. And I'm getting ready to start Kisqali soon. The medication for 1 round is approximately $15,000. Between $15,000 and $19,000, depending on the dosage that you take. And I have to do 36 cycles of this drug. 36 cycles, aka 3 years. So that's expensive. Very expensive. And the doctor was like, you know, we're going to run it through your insurance, and, you know, depending on what your copay is, there are grants. And I did mention that when I was on my first chemo, I had to have 4 cycles of Neulasta, which is that drug I mentioned that you take it 27 hours after chemo, and it makes your white blood cells like produce more in your bone marrow. And I needed 4 cycles of that, and my insurance paid for it, but my copay was $1,800. okay? The copay. And I had to do that 4 times. So I can't do math in my head. We're just gonna say we're gonna round it up to 2,000, okay? And we're gonna say 2,000 times 4 is what? $8,000 in copays just for one drug. So Kisqali was up there, and for the full cycle, the full treatment, the 36 cycles would have easily run up to like $500,000. And I'm just like, oh God. So we put it in, but yesterday I got the call from my insurance provider, and I don't know how it works, but apparently my employer has this program with pharmaceuticals in Canada. And so I'm going to be getting my drugs shipped over the border. So thank you, Canada, for helping me out. And there is no copay. And since I am opting into this international program, my employer will reimburse me $200 for every quarter that I am on the drug. So, hey, thank you, Jesus. Thank you, Canada. Thank you to my employer. Like, wow, I didn't know this stuff existed. So hopefully we'll be starting that drug really, really soon. Am I nervous about it? Of course I am, because there's so many side effects. And maybe I'll talk about that in another video, because it'll just be too long on this one. But physically, that's where we're at. And that's where we're at in terms of my cancer treatment. So I'm still in active treatment. I'm still a cancer patient. And this, I guess, will be our segue into the next thing I wanted to talk about. Emotionally, it's tough being on this end of cancer. I remember my first oncotherapy session, and the therapist, I was in tears, and she was like, you're gonna be on the other side of this. You will be on the other side of this. And I held on to those words, and here I am, technically on the other side of it, and I feel crappy. I feel sad, depressed. You know, I'm going through stages of grief, the realization of everything I've experienced this year. It's hard. And then you have people that congratulate me, and I'll accept the congratulations. Oh, thank you, you know, but that's hard for me to accept, because, like, what are you congratulating me for? Because I rang a bell? So that's hard, because to people, you know, you ring the bell and you're done. Even my own daughter, oh, but you rang the bell. Cancer's over. And it's like, it's not. It's weird. It's weird, because when I had cancer, I was fine. I felt fine. I had no pain. I had no symptoms. But then once the cancer was discovered, and then you start all the treatments, now I feel like garbage. I'm tired all the time. My body hurts. I've got scars and lines on my body that I've never seen before. I've got stiffness. It's weird. I'm starting to get a lot of nerve pain in my chest where my nipples used to be. I'm not gonna show you, but see, I was drinking coffee. Sorry, but like, so this is the breast mound, right? I have an expander in, right? 2 expanders, both, and so my nipple, I had big boobs, right? And my nipple would hang down here. So they literally cut the top of the nipple and the whole bottom part of the breast, right? Let's just, because it's hard to visualize. I'm talking about like big, saggy, mommy breasts. Let's just give you a better visualization. So nipples usually right here in the center, right? So what they did for me is they cut above the nipple. They cut this whole part off, scooped it out, and then this little piece of skin that was left, they literally pulled it down and sewed it. So what used to be the top of my nipple is now the bottom of my breast, the bottom. And if I were to show you my actual skin and whatnot, you would see that at the bottom, you could see the dark areola, the round part, a little piece of it. And so because there's still a little tiny piece of the areola of the rim of the nipple, I think they're starting to wake up and it hurts. I get like this shooting pain that I kind of have to like hold myself. So that's that's new, different, and fun. What else? My arm, you know, I haven't been going to physical therapy because that's another thing. It's so difficult to coordinate therapy sessions with my job schedule and picking up the kids after school. And my husband gets home late. Sometimes he goes home at 5, sometimes it's 6:30, sometimes it's 7, sometimes it's 3. You know, there isn't really like a set time. So it's hard to keep those therapy appointments. So I've had to stop. And then, of course, I'm just lazy and I haven't been doing them at home. So we have that. But back to the whole like emotional state of it. I don't know. I'm in a weird place. And I thank everyone who prays for me and congratulates me. I do appreciate that. But it's weird because I don't know. I can't even put it into words how I feel right now. I just know that I don't feel like myself. And the other day I was having a moment. I think it was on the 30th. I was just dying for October to be over. Like I've mentioned before, I don't like, you know, all the pink outs. I've never been a fan of that. And that was way before I had cancer. I've just never been a fan of it. And I was dying for October to be over. I didn't realize how triggering October was going to be for me at 1 year after, like the 1 year anniversary. It was quite triggering and just a lot of anger. Just a lot of anger. But I think it was on the 30th or the 29th, one of those days. I'm in my bed and I'm, you know, opening up my emails, whatnot. I try my best to open up my email first and read the devotional that my bishop and my pastor, they send out every morning. So I did that. And then I was like, oh, let me check some other emails. And I was like, you have a signed document in your portal. Signed document for what? And when I went in, it's the letter declaring that I've completed my cancer treatment, or at least like the surgical part of it, blah, 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 and just, I guess, signing me off. And I was just like, oh, is this like a certificate? Like, yeah, you did it. I don't know. I don't even know. I briefly read it. I haven't even opened it up and fully read it, but I'm going to this week. I don't know. It's just a weird place to be in 1 year out from the cancer situation. But I guess the biggest question that most people have is, so are you cancer free? And the question, or the answer to that question, is yes. And it's a weird yes. So I don't do scans because when I was initially diagnosed, there was the tumor in the breast and then the one lymph node that was lighting up. And they got all of that out. However, because the one lymph node exploded, extranodal extension, for sure, microscopic cells leaked into my axilla, aka my armpit. And scans cannot pick up microscopic cells. So there's no reason to subject me to an MRI or a CAT scan and subject me to more radiation that I really don't need to be subjected to because it won't pick it up. So instead, I do two things. I have a CA27, I think that's what it is. If it's wrong, I'll correct it. But it's a cancer antigen test, and it's a blood test. And so I had my first one, and the first one, I forgot what the numbers were. And I guess anything under, let's say 37, I believe that was the number. Anything under 37 is considered normal, considered no like detectable disease. And I was like a 25 or something like that. So I came back normal, which means at that first blood test, no cancer is detected. So cool. But I also opted for the Signatera test, and I was very excited when I was approved for it, and I got the test box at my last appointment, and they drew my blood for it. And then this week I got the notification that the lab received my Signatera test. And you're like, well, what's a Signatera test? So Signatera test is it's pretty new, and what they do is they take your original tumor, so the specimen, I guess, which I was like, they keep that stuff that long? I thought they just did the biopsy and throw it out. Apparently no. So they take the tumor, whatever, and then they create a specific blood test that is only tailored to me, to my DNA, and to the tumor's DNA, or the tumor's biology. So it's not a blood test that if they create it for me that I could use it on my sister or somebody. They can't use it. It won't match. It's only a match for me. So I was excited because I took my first Signatera test, and that test helps to find circulating tumor cells much sooner. And so since I'm at high risk of recurrence, I want that test. And so that test, I think I'm going to get it maybe every 3 to 6 months. I'm not sure. But I just had my first one, and I'm still waiting on the results. It takes about 4 weeks to get the results. And it'll serve as a baseline data point, right? So I've got the cancer antigen test, the Signatera test. Those will be baseline data, the first ones that I got. And then the next time I do those tests, they'll monitor the numbers. Are the numbers going up? Are the numbers going down? Are the numbers staying the same? And just because the numbers go up don't necessarily mean that cancer has returned. There could be a slew of other things like inflammation or other things that may make those tests go up, but it's still a good data point, a good baseline to have. So that's where we're at. Overall, am I happy? Yeah, I'm joyful. I always choose joy. I really do. I always choose to laugh. I always choose to try to see the brighter side of things. And I have been leaning into that. And I feel happy and I feel joyful. I feel conflicted at times about being celebratory about this date. Like, hey, right now I'm NED. There's no cancer in me. I fought cancer. I'm a little hesitant to do that kind of stuff because I just feel like, what if in 3 months it comes back? Or what if in 2 years it comes back? Or what if in 10 years it comes back? I don't want to celebrate so hard right now to then be let down. So I think cancer has quieted me quite a bit, in the sense that I'm not so quick to celebrate things, because I feel like I'm constantly living in a state of what's next? What emergency am I going to deal with next? And I hate living like that, but that's where we're at. So to wrap this video up, this is a weird place to be in, but I would rather be here than not here. I'm grateful to God for my life because He has preserved it up until this point, and I feel like He will continue to do that. Grateful for my husband, my children, my students, as annoying as they may be sometimes. I really do enjoy being their teacher, and they do a lot for me. They don't realize it, but you know, when they come through and they do what they got to do, it's refreshing. But thank you to everyone who has prayed for me, who still stands in the gap for me. I appreciate that. I have two people that are close to me in my life. One not like close, but like I've known her for years, and she's been recently diagnosed, and it's like, oh. And then a family member was also recently diagnosed, and it's just like, oh. But if God gave me the strength to get through it, He's gonna give them the strength to get through it too, if they choose to lean on Him. So I don't know what else to say. It's a 27-minute video. That's really long. But if you have any questions, I'm going to try my best to get back on here and vlog a little bit more. I will bring you on the journey. And you're like, what journey? The hormone blocking journey? Not really, because that's a boring journey. But I think, you know, maybe in a month or two, I'll update you guys on, you know, Kisqali and how the new drug is affecting me and whatnot. But I'm excited because at the end of this month, I am going to find out when I can have my surgery. So that's the journey that I'm going to be bringing you guys on, because mommy's getting plastic surgery. Cancer done took my boobs away, but cancer gonna give me fake boobs and a flat tummy. So I will bring you on that journey, and I'll let you know when that's gonna be. Lord willing, it'll be in March. We'll see what the doctor says. And then I don't know, I feel like the girls need to be bigger. What do you think? I don't know. Should I go bigger? I don't know. I want big tatas. See you on the next one.